At KSMO Radio, we welcome you to Friday morning. It is 8:30, and we have a special guest in this morning to talk a little bit about things that all of us will eventually be affected by. It's Jennifer from Wise Medicare. Welcome, Jennifer.
Thank
Glad
you
to
so
have
much.
You here.
Thank you.
And, of course, we all know that this is very simple.
Very
Medicare,
easy.
Social Security. It's all really easy.
Very black and white.
Yeah, a lot of shades of gray in
Yes.
there. I mean, all different kinds of shades of
That's
gray
right.
in there, not just one. But every year, Medicare changes.
That's correct.
Every year there's different plans available. Every year people really need to take a good hard look at the coverage they have, any changes in their medications, or maybe even in the coverages that they think they might need to increase, or maybe other benefits they're looking at. That's what Wise Medicare does. You guys help sit down, talk to them, give them the whole gist of what this is all about. And you might be on Medicare now. You may not be getting even the right coverage now.
That's
the
correct.
best for you, right?
Yeah, and I think the biggest message there, at Wise Medicare, our services don't cost you a thing. So I think there's just a lot of apprehension to even talk to somebody. Oftentimes when I'm at events, people will pass me like, I already have Medicare. Like, well, that's great. Like, that's why we're here. I think the most important thing is don't be afraid to ask questions. Companies like ours at Wise Medicare, we want to just make sure that you are taken care of. That does not mean coming in and we have an agenda to change your policy. Our agenda is to educate. We want to make sure that every year you know what your options look like, whether you're on a Medicare supplement and prescription drug plan or an Advantage plan. Knowing how those plans are changing, making sure that you're reviewing rates and costs and premiums and prescription co-payments every year is just really important for you. That way there's no surprises. We can have a discussion about what's on the forecast.
Sure.
What are things that you might, be concerned about for next year, or things that have popped up this year that you're starting to navigate. We can have those conversations with you. And I think the value that I bring beyond just that discussion is that I meet with a lot of people. So I've learned a lot about various experiences, and I can help you navigate some of those situations. At Wise Medicare, in addition to just doing a plan review, we're here year round. So when I say that, I really mean it. Customer service is paramount. My job is to make sure that you have a positive experience across the year, whether that's reviewing billing concerns, helping you navigate provider access or prior authorizations, or your medications no longer covered, or costs skyrocketed. Anytime you've got a question or concern, pick up the phone and let's talk. Let's see how we can navigate a solution for you that brings peace and less stress in your life.
And sometimes even the insurance companies that offer you a drug plan or something may cancel that. They may not offer it the following year. So if you think you're just going to automatically be renewed, you're going to find yourself in a heap load of trouble.
That's true, and we are seeing that this year. So Anthem, for instance, their Advantage plan, their HMO, if you're on an Anthem HMO plan, that's going away next year in a number of counties. I think Pulaski is still being retained, but for Dent, Phelps, Crawford, all of those individuals have to find something new. So if you haven't received your annual notice of change document, which is sent by your insurance carrier, that is a document that will talk about how your plan is changing.
Right.
Really important to take a quick look at that, see if there's any red flags or areas of concern. A lot of the Advantage plans are making big shifts in prescription coverage. They're also making big shifts on benefits, whether that's reduction or elimination of coverage for dental services. So we just want to make sure that you know how your plan is changing, see if that's still an appropriate fit, and then share some other options that might be available.
Getting your questions answered is key to what you guys do, because people may hear all these TV ads about Medicare Advantage and Medicare and Supplemental B and then Supplemental D and then all these other supplements that they seem to come up with. I think there's so many different supplements. Some don't exist anymore. Some carry over if you've already had them. I mean, when somebody from the outside looks at this, it can be a quagmire of information that you don't need to try and interpret it yourself, because you are one person, and this coverage that what you guys do, you do it for everybody. You understand all the ins and outs and how this would affect this person versus this person, the different counties that are involved, the different coverages that are there.
Right.
That's a lot to absorb if you're trying to do it yourself, and it does become overwhelming, doesn't it?
And I will say to that point, I'm a big advocate of telling anybody that I meet with, please don't answer your phone. Take it from me. I truthfully don't even like to do phone appointments where we have these discussions because it is so much information. Clarity and having just the ability to look each other in the face, see when your eyes are glazed over, or you're starting to get red because you're getting aggravated with
Sure.
what you're hearing. Those are important moments to have in a conversation. That's where we build trust. That's where we really get an understanding for where your needs are. We also know the area. We know what works and what doesn't across all of your options. We can help navigate some of those local resources. We spend a lot of time with lower income populations on the Medicaid side.
Sure.
I've got a great relationship with Department of Social Services, and so I help people see if they're eligible for Medicare savings programs. If you have never asked the question, you may be eligible to get your Part B premium paid for. That is your red, white, and blue that comes straight out of your Social Security check. We can help get people enrolled into Medicaid if they qualify, which will enhance their benefits on the Medicare side. Just a lot of opportunity there. One of the biggest advertisements that I just despise is that grocery card. They get free groceries. Please know that really is an income-based program.
Oh, yeah.
So if you are on Medicaid, you probably will qualify for some of those plans. If you're not, those are just gimmicks to get you to pick up the phone, get on they really want to sell you something. Sales is not in my vocabulary, and I assure you, you will not feel that way when you come and visit with us.
And they're going to tell you every single perk, whether it's there or not.
That's right.
And like you're mentioning, income levels are very big. If you don't qualify because of your income level, no matter what they do, they can't get you that benefit.
Right. And they don't know. I mean, it's easy for them to plug in your doctors, but they don't know the area. Oftentimes, these individuals will change your policy, and then you get to go to use it, and you realize, you really can't use it because it's not accepted anywhere, maybe on the benefit side or whatever. So, please never make changes by phone. Always call. If you come across a plan that's different than yours that you want to talk about, let's just meet, look at them side by side, and make sure that it's a good fit.
And one of the other things about meeting side by side and sitting down and seeing it, you're showing it to them on paper.
And we leave with everything in paper.
On paper, in writing. This
That's
is what you
right.
have. And then also the neat thing about it is you guys aren't rushing anybody, because you can't make a 15-minute appointment at Wise Medicare and get all the information you're going to need and then say, well, thanks, come back. We're happy for your business. You're trying to get them out. That's not what you get at Wise Medicare. That's not what you get with people who really care about you. But on the phone, they want you to sign up as soon as possible before you have an idea of what you're actually getting.
Yes, and on the phone, you're probably going to have a much longer conversation, too, that is frustrating and annoying, and then you're, locked in because you feel like you've been on the phone for so long and you want to get off. But to your point, we do not. There is no pressure. Most of our appointments take anywhere between 45 minutes and an hour to start, and I never, unless you're ready to make a decision,
Sure.
I always want you to take information home because it's important to me that you feel confident about your decision, that we've addressed any areas of concern, questions you have, and if we haven't, let's meet again. I mean, I'll meet with you as many times as you want.
Sure.
Again, my services don't cost you anything, so I'm here as a resource.
So before we came on the air, I was asking Jennifer about changes being made. There's always changes every single year in coverage things, but also, with the new administration in, and right now they're all
Taking a break.
laid off. Those changes that will affect you, I mean, that's starting to come out here in the next week. October 15th is beginning of the enrollment.
That's correct.
And when you hit that date, then pretty well everything has to start kind of being in place.
Right.
So when you start making decisions, that will carry you over for the next year.
That's correct.
1 year. Do not think that that's going to carry you over for the rest of your life. Years ago, and we had this conversation, my dad was on Social Security and Medicare. He never had to pay a dime in for Medicare. There was no deductible. There was nothing. Everything was paid for. Well, those times have changed. And that ended in 2020 when they started taking out a monthly stipend from either your Social Security check or you could have it taken out of your checking account,
Right.
which I thought was, why, if the check's going in my checking account, why would I authorize something to come out of my checking account? That didn't make any sense to me at all. But it's there. It's a possibility. But all these changes started happening, and he never knew it. He would never have known it.
Right.
He never got anything in the mail, never got anything, and all of a sudden it's just passed by Congress, it's done, and they're going to implement this. When somebody sits down with you, they're going to get the latest information about what's going on, the different policies that the government has with Medicare, including your drug plan. You don't have to have a drug plan, but if you don't, you're going to pay a penalty later on down when you take one.
That's right.
And a lot of people don't know that.
Right.
And knowing it's not a heck of a lot of money, but it's a heck of a lot of money if you wait 4 years to do it.
It is, yep, and we'll help to calculate those costs. A couple things to note on that. So with the government shutdown, I know we've received a couple calls already, like, how is this going to affect my Medicare? Really, it shouldn't in terms of your coverage. Your coverage is in place regardless of the plan type. Where you may see impacts will just be in the processing of payments. If you're on a Medicare supplement plan, that's probably the most impact, where your providers just might have a delay in costs. But for next year, in true Medicare fashion, everything is going up, right? So that is really the message that we're making sure you know. For those that are already on Medicare, your $185 premium that comes out of your check, or to your point, you may be paying quarterly if you're not drawing Social Security yet, that's going up to $206.50, and that's a pretty significant jump over years prior. Medicare supplement policies, you'll find your Part B premiums going from $257 to $288. Prescription drug coverage is a whole nother discussion. This year I would say advancements were made to help start to reduce those costs for consumers. You had a $2,000 maximum out of pocket, but carriers felt that this year. They assumed a lot of those costs, and so this year you're seeing premiums increase as high as $50 on your prescription drug plans, which is the Part D part of your coverage. So really monitoring that is important from a cost perspective. We're also seeing a lot of your brand level medications. If you're familiar with your tiers, that would be tiers 3, 4, and 5. A lot of the plans are switching from a fixed co-payment, like $47, to a percentage share. So now instead of paying a $47 flat fee, you may pay 20% the cost of your medication. So while you are still capped now at $2,100 for next year, I think your monthly costs, if you're on those level of medications, are going to be a lot higher. And so that's something we want to forecast for you. Our system, we are a broker, so we do represent the majority of companies in our area.
Sure.
And that will forecast on a monthly basis, what do those costs look like? Sometimes making a change of pharmacy, looking at options like GoodRx or other sources outside of your company's coverage can help to lower those. And that's just a big puzzle game that we sit down with you. It's really a complicated part of your Medicare, but we really do try to navigate how to lower those costs as much as possible.
So it's very important for somebody who wants to come and sit down with you and get a drug plan to bring in the list of prescriptions you have.
Absolutely.
And sometimes you might be on a generic of something else, or you might be on the name brand. If there's a generic, a lot of times you might be able to find a better price because there's generic for the very same thing. You're not going to be, it might be in a tier 2, the generic's tier 1.
Right.
How is the difference? I don't have any idea. I don't know how they figure their tiers. I really don't. But I leave that to people like you.
Yes.
Figure
well,
that.
And I'll tell you.
But that's true. You need to bring that full list of all your prescriptions in, and any over-the-counter medications you might be taking too. That maybe you need to tell your doctor about that too. A lot of people take a supplement vitamin. They think it's not a big deal. Well, some of those don't mix real well with medication.
Definitely. And just so you know, when we have that discussion about medications, I'm not a doctor, so I'm not going to tell you to switch to this medication, but we will definitely leave you with some of those message points to have that conversation with your doctor.
Sure.
If we find some generics or alternatives to the ones that you're taking that are covered better, I'll encourage you to have that conversation with your provider before we make any changes. Let's see what they say. If they agree that that might be an appropriate shift, then we can kind of forecast based on the new medications. But Medicare is it's unfortunate that it's such a headache because it really, on the face of it, is pretty straightforward in terms of your pathways and what types of coverage are available. But the government has just really diluted that and made it impossible, truly, for everybody to know everything that they do. The enrollment periods are complicated. Knowing when you can switch, how you can switch, where you can go, what's covered. It's just a lot. And we want to take that burden off your shoulders. We are experts in this area. Let us help you.
Right. And as we mentioned, October 15th is the beginning. When is the end of the original enrollment period?
So annual enrollment begins October 15th through December 7th.
Okay.
We are already scheduling lots of appointments, so please give us a call, 573-364-5446. And then really, anytime you've got a question. I mean, turning 65, coming off of employer insurance, these are all opportunities where there's a lot more discussion to be had about timelines and when we can get you started. A lot of nuances too. If you're still working, we just want to make sure you're set up and we kind of keep you on that path.
Yeah, so if you're 64 and a half, you may want to give Jennifer a call, sit down with her and say, okay, middle of next year, I'm switching over. How do I get on Medicare?
Absolutely. When you're turning 65 or coming off of your employer insurance, it's typically 3 months before that date. So if your birthday is in March, we're going to start probably talking in December. But we kind of start that conversation. A lot goes into that. Are you still working? Are you drawing Social Security? What are your areas of need? And then we'll kind of walk through, do we need to take Part B, the premium portion of Medicare
Right.
at this time, or can you defer it without penalty?
Sure.
If you're somebody who's already started Medicare and don't have Part D or maybe don't have Part B, still come in and talk to us.
Sure.
Let's see what opportunities there are to navigate that penalty, and sometimes we can't help to get that reduced.
Yes. There, as you mentioned, it's kind of a quagmire of information
It is.
to try and sift through to see what applies to me.
It is.
And so let the experts do it. Jennifer's one of those experts over at Wise Medicare. All you got to do is call, and that number is
573-364-5446.
better to make an appointment, because if they walk in, obviously you guys could be kind of busy. You might be waiting for a while. But you're on North Bishop Avenue, correct?
We are. We're at the corner of
In
8th
Rolla.
and Bishop, just north of the Seven Brew Coffee Shop, if you're familiar with Rolla.
There you go.
To your point, we will always welcome you if you walk in.
Sure.
As long as my door's open, I'm happy to meet with you. But enrollment season's pretty crazy.
You
We really recommend definitely getting an appointment. But outside of enrollment season, my door's always
Sure.
open.
But definitely take the time to get this done, and don't wait till December 6th.
Please don't.
If you haven't had any coverage before. And if you are thinking about looking into this yourself, feel free to do so. But before you make decisions, get in touch with somebody and go over what you have found, because you may be misreading something.
Definitely. And I think that's a really valid point. We have a lot of trusted people in our lives, whether that's family members, coworkers, friends. Please remember that Medicare is not a one-size-fits-all.
No.
There are a lot of opinions about different plan types, but our job is to educate you on what those plans are and how they work specific to your needs. Not every plan type is right for everybody. You have your Medicare supplement and prescription drug plans, which are a little bit more cost heavy with coverage on the back end, where Advantage plans are more of a pay as you go, very similar to group insurance, and can come with added benefits that people may really need.
Right.
Our goal is not to tell you one is better than the other. It's to educate you on what do those look like from a cost, a coverage, and an experience. There are different experiences that you will have on each of those pathways. For those that are on Medicare supplement plans, make sure you're reviewing your rates every year.
Oh, yeah.
Missouri has an anniversary window at 60 days. It's based on the effective date of your policy. So if you started your policy in February, the beginning of March or January through the end of February is when we can run those.
Right.
If you're not doing that, check in with us. Let us just make sure that you're not overpaying for the plan type you have. And again, with Advantage plans, a lot is changing on those, so... And you have a lot of, there's like 40 plus plans in our area,
Oh,
so there's a lot to choose from.
There's a bunch, and some cover this and some cover that,
Right.
especially when you get to Medicare Advantage programs.
Yes.
They don't all, it's not a one-size-fits-all.
Definitely
And it's
not.
not a one-coverage-fits-all, and it's not a one coverage covers everything.
Right.
So, and if you have some benefits there that you think, man, that'd be great, that may only apply really in big cities.
Right.
So if you're not in a big city, which we are not,
Right.
it's not going to do you a lot of good to get that plan. So
Absolutely.
that's why you need to really talk to somebody who really can understand and decipher some of the things that are explained in these plans. They're not hard to figure out if you just would read them and then one step one thing at a time.
Right.
I think it's the easiest thing. But I think we're all a little bit in a hurry. We kind of scan it. We think we understand it. We may not totally understand it, but we think we make a good decision. Jennifer, that's just not a good decision to make if you don't fully understand.
Right.
So sit down with somebody who can sit down, go over those points that you might see. Maybe you printed it all out, bring it in, circle things you don't understand, and then they can ask you right there, what does this mean? What does this mean? And you can explain.
Absolutely. And please, I really encourage that. That is 100% why we're there year round. Remember, I'm part of this community also. So reputation is important to me. I want to build that relationship. I want you to be thinking about us when you have a question or concern, knowing that we are that resource there for you to help make your Medicare experience that much better. It's no different than going to a realtor to buy a house. You're not just going to go to the street and put an offer in on a house without working with a professional. And your healthcare shouldn't be any different.
Right.
That is a major part of your life, and it's very costly. And so we want to make sure that those hard-earned dollars are being used wisely.
Absolutely. Give that number one more time if you would.
Yes, sir. 573-364-5446, the corner of 8th and Bishop in Rolla, and we have wisemedicare.com for additional resources.
Hard to believe it's that close already, but
It is,
here
I
it is,
know.
right on to October. Jennifer, thank you for coming by and explaining a lot of these different things to us, and I hope to hear from you again. Maybe we'll do an update here and getting near the end of the enrollment period and remind people about what's out there. And if that's a good with you, it might be
I would
something you
love
might
that.
want to do
Absolutely.
that to remind people that this is very important, especially if you are on Medicare, to get this done.
Absolutely.
I know a lot of people like to put things off. I try and get this out of the way as quickly as I can.
Right.
Well, it's going to affect you. It doesn't matter if you do it October 15th or December 7th. The problem is that if you see something that you would like to explore, if you wait till December, it's too late.
Right.
Because people like yourself are usually jammed up at that time, hard to get answers, and then you get on the phone like you mentioned, and you get one of these companies that will make your mind blow because they're going to throw you so much information.
Yes.
You're not going to have a clue what they're talking about.
Definitely.
So I would do your due diligence on your own, but then when you're ready to go, give Jennifer a call. Stop by Wise Medicare, whichever you want to do, and probably setting an appointment is the best thing. But take your time, read what you think is right for you. Like I said, print it out, come over and say, I found this plan, and she said, that's a good plan, but we've got this one that's $80 a month cheaper. Well, okay.
Right.
$80 a month times 12. I'm thinking I'm liking this.
Yes.
And that's what you guys are all about. Find the best price for the best coverage for that person.
Absolutely.
Not for everybody. That person
Yes, sir.
who's on Medicare.
You got
That's
it.
what it's all about. Jennifer, thank you very much for coming in, spending some time with us on KSMO, and we look forward to seeing you again. You have a fantastic weekend.
Thanks. You guys too.
At KSMO Radio, you're